One of the whole reasons for the existence of the Roam program is that we've recognized for many years the lack of medical services and physicians in rural Texas.
Doing the Roam program, there's things that you wouldn't even think of that are actual healthcare disparities, like I said before, translation for refugees, but also just their socioeconomic status, needing to work longer hours or work shifts on Saturdays or not being able to take off work during the weekday to be able to go see a doctor. That affects refugees, but also the rural population.
Many of our rural communities are located in places that just have either lost hospitals, who have never had hospitals. And so our mission here is to try to reverse that trend and try to get more doctors in rural areas and more facilities able to be sustained in rural communities. The RHI, or the Rural Health Initiative, is something that we've developed over the last 3 to 4 years here at TCOM. A student-led initiative. I've been available as their faculty sponsor, but we've been then also providing opportunities for students, both Roam and non-Roam students, to see patients at some of the apartments and living arrangement areas that our refugees are congregated in. And it's been really an amazing partnership.
Texas is one of the top 3 places for refugees to come in the United States, and the DFW area is one of the biggest areas for refugee resettlement within Texas, so there's a really big refugee population here. Yeah, so most of it is just primary care. They're really looking to either check up on our blood pressure or diabetes. You know, they may have been told years ago that they had this issue, but they either don't have the opportunity to follow up or don't have insurance or what have you, and so there are barriers that they haven't been able to actually get those taken care of, so they've got these issues kind of brewing in the background. Definitely being able to interact with people from other countries and just seeing how they're just like you, they laugh at the same jokes, they can hold a conversation and have families, and getting to see little kids and all that kind of stuff. It's really cool to hear that and then hear their stories of what they went through, how they came and ended up here. It's just crazy what some of them went through.